Thank you to the Bevan Commission for the opportunity to share our work today. Our project focuses on the Healthy Start vitamins and specifically exploring the barriers and solutions to increasing accessibility for eligible families across North East Wales. Leading on the project is myself, Andrea Basu, and Sarah Powell-Jones. So by way of background, it's essentially a UK-wide scheme that provides eligible pregnant women and families who have children under 4 with weekly food and vitamin vouchers. And the Healthy Start uptake in the last 12 months has varied between approximately 53 and 62% as the Welsh average. Essentially what that means is that figure of 53 to 62% of families are those that would be considered eligible, have applied and have successfully been signed up to the scheme. So we do have a significant number that aren't yet signed up. And in North East Wales, typically the average falls below the Welsh average. So in March, for example, in Wrexham and Flintshire, the uptake was 56% versus the Welsh average of 61%. Now, specifically, the Healthy Start vitamins provide key nutrients such as folic acid and vitamin D, which are recommended for supplementation in these key population groups. Vitamins are typically distributed via midwifery and health visiting teams. However, during the COVID pandemic, this has impacted on access for many families and at the same time presented an opportunity for us to explore some additional points of access, particularly in supporting ongoing provision of the vitamins beyond the initial 8-week supply. So our principal aim was to increase accessibility of the free vitamins for eligible families across Wrexham and Flintshire by scoping the journey of these eligible families in getting the vitamins, clarifying the local distribution arrangements that were in place so that we can then identify some possible solutions to improve access and hopefully consequently uptake. Implement those solutions and then cascade clear and consistent information about how to access the vitamins themselves. And therefore the outcomes that we achieved are as follows. Okay, so looking specifically at the family's Healthy Start journey. The family first hears about Healthy Start, usually via their midwife or their health visitor, but they may also find out about the scheme through family information services or through Fine Start family centres. So first of all, the family completes a paper application form and they can return that free post to the national team, at which point their eligibility is assessed. Once assessed, if they're considered to be entitled, every 8 weeks, the family is sent a green voucher in the post, which they can hand to their midwife or health visitor in exchange for the vitamins. The paper applications no longer need signing by a health professional, which has made it slightly easier. And also in time, we envisage there being digitalised forms available because currently families have to print the form off or obtain a copy from their health professional. Arrangements for distribution are different in Wales compared to other countries, England and other home countries, and the responsibility for distribution here lies with our health boards. And so we felt there was perhaps an opportunity for us to engage community pharmacy, particularly since they were an accessible and easy point of contact during the pandemic.
Okay, so moving on to look at distribution of the vitamins, we wanted to clarify and identify local distribution methods. So at project inception, we found that local pharmacies were not particularly engaged in the scheme. We carried out a local audit with all the community pharmacies in Wrexham and Flintshire, and it identified that none at the time was stocking the vitamins. Some were not aware of the scheme at all, and others wanted to know more and were interested in engaging in the project. There was confusion regarding where families should access the vitamins. So conversations with senior colleagues in midwifery and health visiting teams identified that there was a mixture of ways in which families were supplied with the vitamins. For example, some Flying Start areas were posting the vitamins to families during the pandemic. However, some health professionals were advising families to go to their local pharmacies to pick up the vitamins. However, this was not possible for families as none of the community pharmacies were stocking the Healthy Start vitamins at the time. COVID-19 and reduced contact with health professionals had an impact on usual routes of access to the vitamins also for families, as many family centres and clinics were essentially closed, making access extremely challenging for families that were motivated enough to actually seek out the vitamins. There was also concerns that eligible families do not return or request follow-on vitamins after the initial 8-week supply. So a small-scale survey with eligible families showed that there was more that we could do to raise awareness of the ongoing provision of the free vitamins post the initial 8-week supply. So, for example, very few families were returning or asking for follow-on pots. So the key outcome that we've achieved was to engage 12 local pharmacies, shown in the visual on screen now, who agreed to stock the vitamins. The Public Health Dietetic team currently order the vitamins via the Health Board, then deliver to the pharmacies who accept the vouchers directly from eligible families in exchange for the vitamins. So, solutions, what did we do? We did some training. So we produced a virtual training package with audio to support all pharmacy staff to increase their awareness of the scheme, the vitamins, and essentially what we were going to ask them to do. So in addition to supplying the vitamins to families, pharmacies also agreed to actively promote the scheme and hold copies of the Healthy Start application forms for any families who were inquiring about their eligibility. And so 279 staff members have accessed the training package to date. This includes pharmacy staff from all the 12 participating pharmacies and a range of other key health professionals, including midwives, health visitors, family workers, paediatric dietetic team members, and some GP practices as well. We also wanted to cascade clear information to families on how to access the vitamins via promotion. So alongside the training we provided for key stakeholders and health professionals, we created a number of social media posts focusing on using Facebook and Twitter to promote as much as we could the new access points for the Healthy Start vitamins. We achieved well over 42,000 views. In addition to the social media pages of the organisations listed, we were also able to share with local community Facebook pages to increase the reach as much as possible. And finally, it's always good to hear about what impact the project has had on others, in particular our partners and ultimately the Healthy Start families themselves. Here are a few quotes to illustrate this. So from health visitors, community pharmacists, pharmacy counter staff members, and most importantly, the Healthy Start parents themselves. So I'm just going to read out a couple. So the pharmacy counter staff stated, parents who have come in with the vouchers say it is great to know where they can now come to get their vouchers. It has made it a lot easier for them. They are telling their friends too, and we have handed out the application form. And then the Healthy Start parents stated, I'm really glad I can pick them, the vouchers up from here now. It makes it a lot easier. So really our ultimate aim was to make access easier for families. And this quote highlights we have to some extent achieved this aim.
And so our next steps. Well, the project is still very much ongoing and we plan to audit next month all 12 pharmacies. Early indications are suggesting that we've uplifted the uptake of the vitamins by approximately 50%. However, we are acknowledging that we've been working on the project throughout the pandemic, and knowing that it's been a fast-track project, we didn't expect to set out or demonstrate an increase in uptake, purely focusing more on accessibility, though clearly uptake is ultimately our main aim. So currently we're looking at pausing and reflecting, and knowing that we were only able to place the vitamins in the pharmacies from April onwards, we feel a longer test period is necessary to enable sufficient time to assess true impact. So we continue to carry on with the provision till the end of the calendar year and assess once again at that point. Like all projects, we encountered some challenges, but equally we've been able to be successfully navigating through those throughout the period of working. So perhaps not being able to train or promote the project face-to-face with stakeholders and the public might have initially been a disadvantage, but using virtual training was efficient for our partners and us, and the engagement we were able to achieve with social media has been good, and we've been able to reach senior managers and internal decision makers through using things like Microsoft Teams meetings quite quickly, and that's helped to get through a number of roadblocks and progress at some pace. So we very much want to evaluate the experience of working with our partnering pharmacies and how we can sustain and extend provision across the health board and indeed other health boards. And like today, we're sharing our learning and key to engage as much as we can with fellow colleagues to see how we can extend this work. So our Bevan experience, how would we describe that? I think both Sarah and I would say it's been extremely positive. We've benefited immensely from the mentoring, the networking and the range of learning events. And I think the kudos of being a Bevan Exemplar project has most definitely helped us to navigate through some of the challenges that we've faced. And we believe it's helped us to achieve solutions much more quickly than we would have otherwise. So we're really thankful for this opportunity and pleased to be speaking with you today. Thank you. Diolch yn fawr.
We will now have a Q&A discussion. What is the potential for this approach to roll out across Wales?
Once you've got the health board, think bigger.
Hi, Lynn. Yeah, I think we would love to see that, and I think having looked at for example, in Scotland and some parts of England, going back a few years ago, there has been engagement with community pharmacy, but approached in a slightly different way, where I think community pharmacies were given an initial monetary incentive to engage and to stock the vitamins and for them to order them directly via NHS supplies. But we tried a slightly different way, really. We thought that, well, we know that, certainly during the pandemic, pharmacies were equally as busy. They were taking on new things. So actually, we were asking a lot of them, and we wanted to keep it as simple as possible. And I have to say, the support that we've had from, within dietetics and therapies and our therapy lead in the East Nester to enable us to have just an additional amount of dietetic assistant time to support this has been vital for us to order the vitamins through the health board and then to provide a small stock to those 12 pharmacies. Whilst it might sound like a slightly odd way of doing it, it's taken the burden off community pharmacies. It's enabling us to see what's going in and what's going out. And actually, importantly, one of the vitamins, the children's vitamin drops, have a very short shelf life of only 10 months. And sometimes they can arrive with only 6 months left on them. So actually using the process that we are, we could keep a check on the stock that the pharmacies have got and actually recirculate them to community midwifery teams so that they're not being wasted. And actually, that's an element that of perhaps research that also could be looked into, really, the risk of perhaps stocking and wastage of some of these vitamins if they're not, given to families as we would hope. So I think going forwards, we definitely want to carry on through another winter because, a vital element of the vitamin is the vitamin D components. We know that during the winter months, that's when it's really important and vital. So great if we can utilise this period again for the remainder of the calendar year to see how we go. But I invest in the approach that we've taken, really. And I think community pharmacy has been really, as you can see from the quotes, really positive about the engagement because we've been able to support them in a way which doesn't create a burden for them. And also, it very much fits with one of their priorities around engagement with public health. That's part of their existing contract. We did explore, do we need to go down the enhanced contract perspective, but we had a fantastic link in BCU, Adam Mackridge, who's been brilliant and supported us in creating the links with community pharmacy, and he's helped us to see these ways forward, acknowledge the public health responsibility that community pharmacies have, and I think from that perspective we've managed to do, cut through some potential red tape and just keep it as simple as possible. So I think this approach is unique. I've not seen this or heard of this exact supply approach anywhere else. Yes, it requires more assistant time from a dietetics perspective, but I think there's wider benefits. The scheme, you mentioned the uptake, we were looking at just the vitamins. The scheme also provides food vouchers. So actually it's a scheme which we really need to promote more to our families that need it the most, essentially. So much more to be done, but hopefully we've made a small dint as a way forward that others can learn from and hopefully take up.
What are the barriers and risks to the continuation of this work?
Yes, I mean, I suppose in a way we've slightly seen one area of risk, which is because I wouldn't want to take on, for example, in the East area, you've got 12 pharmacies, 6 in each local authority area. I think that's more than enough. I think we cover the key communities where our families are most likely to receive Healthy Start. And I think actually we need to be careful that the supply that we give to those community pharmacies is utilised. We had an instance where one pharmacy hasn't supplied us, you got through as much as we would like in the time that we've given them, because we go back every 2 weeks and just review the stock. But because of the short shelf life of the children's vitamin drops, we've been mindful of that, but we have been able to recirculate those vitamins so that waste doesn't occur. So that's a risk, but one that we're aware of and we're managing. So going forwards, that I think should be taken into account in any kind of protocol or process whereby, for example, dietetics would support perhaps the supply of these vitamins to pharmacies. So that's something that needs to be considered. The other thing, of course, is we're focusing on the families that are eligible to receive these vitamins for free, but there is an opportunity for pharmacists to purchase them directly and charge families that aren't eligible to receive them. And there's merit in that as well, because, the need for vitamin D is universal, but, obviously we're focusing on the most at need families. So again, it's whether or not that's an element of the scheme that needs development as well. But then how can we manage that successfully alongside this approach? So I think there are all those considerations, and probably more we need to think about when we look toward it next month. We may then identify some more barriers and things that we need to work through. So we're still kind of learning, but it's important that we do that and note those things, particularly before we look at adopting and spreading the approach. We want to try some of the errors to save people making those errors too.
Is there opportunity to work with wider community partners, not just pharmacies?
That's an interesting approach from Halvara, and not one that I was familiar with, but I think potentially, yes, there is scope there. I think the model that we were seeing happening for distribution prior to starting the project was, clearly, community midwifery and health visiting colleagues providing the vitamins for families, and that was a good system, but more challenging for after the 8 weeks and getting subsequent pots. So I think your approach is a good idea, as well as our approach as well, obviously, where we know that community pharmacies are really accessible. One of the things I wanted to look at was accessibility in Wales within some of our key communities, because I know there's been work in England looking at families in our most deprived communities can access by foot pharmacies within 20 minutes. So that's a great outcome, really. So if you're not a car owner, you can walk 20 minutes and you can hit your local community pharmacy. But so those are all things that we need to think about as well. I know there's also on a national level, they've looked at supermarkets and stocking, but that's the nearest we've got with our project is we've got pharmacies in Morrison's that are supplying, and actually I think we've shown that works quite nicely, because families can use their food vouchers and also collect their vitamins at the same time. So again, more things to explore.